Good morning, everyone. So this week I am still on orthopedic rotation, but I want to show you the outpatient side of being an orthopedic surgeon, because obviously you still have to see your patients in the clinic, follow them up after surgery, admit people who want surgery, and all that stuff. So yeah, I want to show you guys what that's like. I think I'm gonna hold off on doing the 24 hours in a day because Wyatt's still been doing the same thing. He's still waking up once or twice at night, and I've been really tired. Also, it's really frustrating because if you guys remember, I've been pumping a lot more and this is all I've been able to get out. And that's obviously not enough for him to drink. So I'm going to do the fenugreek and maxi milk this morning. So I'll show you guys that. 7:20 and I had to go to work soon, but Wyatt just woke up. Hi, sweetie. Hi. Do you want this? He's awake and I had to go to work. You're always so happy in the morning, huh? Yeah. Mommy loves you. Kissy. Kissy. Love you. This is what I'm wearing to the clinic. Some hammer pants and a shirt and a cardigan. Bringing extra socks and shoes because we might end up in the OR this afternoon after clinic. So let's go. So I don't think I made it very clear in my last video about different surgery subspecialties. I did talk about like trauma surgery, plastic surgery, and orthopedic surgery. Like those are all different things, and that you should really figure out what you want to do if you want to be a surgeon, what type of surgeon you want to be. But then I think I don't. What did I mean to say? I don't think that I actually gave orthopedic surgery the full picture of orthopedic surgeons, because within orthopedic surgery there's a lot of subspecialties as well. So I'm actually working with 3 different physicians, and 3 of them I think specialize in all different things. Like the guy that I was with in my last vlog that you saw did a lot of total knees, total hip replacements. He's like the replacement guy, as he calls himself, and it's more of, he calls himself the carpenter. It's really crazy to see him in surgery and the things that he does. But then the other physician is like a hand surgeon, or specializes in hands and the upper extremity. So that can be a lot less carpentry, more finesse, more like, I don't know, dainty. I don't know how to really describe surgery, but less power drills, I would say. And then the last orthopedic surgeon that I will be with is actually has a special so the last orthopedic surgeon that I'm with actually did a fellowship in sports medicine. So after these 2 weeks, my next 2 weeks would be sports medicine. So keep an eye out for that. So yeah, heading to clinic. This one is a satellite site, so they have their own like little place, like 5 minutes from the hospital. So this is almost exactly what a knee replacement looks like. Super shiny, stainless steel. And what they do is actually saw off all the parts with arthritic bone from the femur and the tibia. They cut the ACL and place this implant in there. They place in this middle part for cushioning, and then the bottom part. Your medial and lateral collateral ligaments, which are the one on the sides, stay protected during surgery because you still need those for stability of the knee. And this over here is the partial knee. Exact same thing, except just half. I also got to see a few total hip surgeries. It's the same thing, basically, except it's like a ball and socket joint. So instead of 2 metal pieces, we have one and like more of a cup. So it is around 11:30 now. I'm gonna head to didactics, pick up some lunch, and pump before didactics. Actually, you know, my usual routine. And then after that, we have a couple surgeries in the hospital, so I get to stay there and I don't have to drive back to this place. So I'm here in the sleep room, where people spend overnight when they're doing night shifts and stuff like that, or they just need a place to sleep. So yeah, I'm just getting all my stuff set up and we'll go from there. So it's after lunch. I am in scrub attire now. Got my shoes on. Rings are off. It's on my necklace. And then I put my Fitbit on my ankle. Yeah. Hi everyone, so I am back home. I've changed. Stan and I and Wyatt are gonna go out to eat. Hey, say hi. Say hi, sweetie. So basically in clinic, I was with a physician today who had 15-minute templates, which means that he sees his patients in 15 minutes. The other doctor that I was with saw each patient in 10 minutes, and it's a lot easier because it's more localized exams. Say if you have hip pain, you're just looking at the hip and the back and the knees and everything below that. But in family medicine, you have to look at everything in 15 minutes. So most of the time patients come in with back pain, but they also have really bad diabetes and heart failure and kidney problems. And so I feel like this specialty or specializing and doing a shorter time frame is a lot easier. During these visits, if they're going in for surgery, you have to, well, first you have to diagnose them, see what they have, see if they're a candidate for surgery or what they need is capable for surgery. You always want to ask about if they tried other alternatives like taking medication, doing physical therapy, doing exercises and stretches, getting steroid injections, and then you go on to discuss surgery. And then you have to see if their heart and lungs are capable of going under anesthesia. So a lot of little nitty-gritty details about that stuff. So yeah, You gotta have outpatient clinic and work in the hospital at the same time. So, oh, and then we also do a lot of casting in the clinic, like the MAs do it or the PAs do it right in the clinic. So those are fun to watch as well. So yeah, we're just gonna go eat. You guys have any questions, leave it in the comment section below. And I hope you guys like this video or these types of vlogs and videos. Give this video a thumbs up. If you haven't already, please subscribe so you don't miss any of my other videos. And I'll see you guys next time. Peace. He said peace. Peace. Tickle, tickle. Tickle, tickle. Hi, sweetie. Tickle, tickle. Tickle, tickle.